Hello friends, so today we are beginning with a new topic, that is occlusion. So before beginning, please do like and subscribe. Okay, let's move forward. So in this section we are going to learn about the definition, development of occlusion, then period of occlusional development, occlusion during pre-dentate and deciduous dentation period, then occlusion during mixed dentation period, during permanent dentation and clinical considerations. Okay, so moving forward, development of occlusion. The term occlusion is derived from the Latin word occlusio, defined as the relationship between all the components of the masticatory system. जो हमारा masticatory system है उसका normal function, dysfunction and para function. So जब हम लोग occlusion करते हैं, सोचते हैं उसके बारे में, तो हमें ये चीज़ समझना होगा कि क्या है वो एक relationship है किसमें, हमारे masticatory system और उसका para function, dysfunction and normal function में. Okay, moving ahead. An ideal occlusion is a perfect interdigitation of the upper and the lower jaw, which is a result of a development process consisting of three main events, that is jaw growth, tooth formation and eruption. Interdigitation, you all know very well that what is interdigitation. See, this is your upper teeth, then perfect interdigitation, that is your maxillary teeth and mandibular teeth. So this is your interdigitation. तो एक आइडियल ऑक्लूजन क्या है, जिसमें एक परफेक्ट इंटरडिजिटेशन हो अपर और लोअर टीथ यानी मैक्सिलरी टीथ और मैंडिबुलर टीथ के बीच में. ये कैसा होता है, एक डेवलपमेंट प्रोसेस होता है, इरप्शन होता है, उससे आगे टीथ आपका मूव करेगा. इसमें तीन मेन इवेंट्स होते हैं, जैसे जॉ का ग्रोथ, टूथ का फॉर्मेशन और टूथ का इरप्शन. गॉट इट? जॉ ग्रोथ, टूथ फॉर्मेशन एंड इरप्शन. जॉ पहले बनेगा, फिर टीथ का फॉर्मेशन होगा, फिर वो इरप्ट करेगा. ओके, मूविंग अहेड. ओके, सो लेट मी मेक दिस क्लियर. Although the interrelationship between the teeth essentially become established in childhood, ये तो दांत बचपन में आ जाते हैं, लेकिन ये कंटिन्यू करता है आपके बुढ़ापे तक, teeth गिरना, teeth आना. So it continues to change to some extent throughout the life. Thus, the occlusion is regarded as a dynamic rather than a static interrelation between the facial structures. Okay? So what is occlusion basically? ये जो है आपका static relationship नहीं है कि teeth आ गया तो जिंदगी भर वही teeth रहेगा. We have primary dentition, then we have permanent dentition. So the occlusion is regarded as a dynamic rather than static interrelation between the facial structures. So what are your teeth? They are related to your facial structures only. Moving ahead, we have 4 periods of occlusal development. Okay, so the occlusion of the teeth may be divided into following development periods. एक होता है pre-dental jaw relationship. Pre-dental आने से पहले वाला दौर, इसमें न्यूनेटल टीथ होता है, नेटल टीथ होता है. Then we have deciduous dentition, we have mixed transitional dentition, then we have permanent dentition. तो बहुत easy है याद करना. प्री डेंटल आने से पहले, deciduous जो बच्चों में होता है, mixed जब transition आता है permanent और deciduous के बीच में, and the final is a permanent dentition. Nothing important as such. Moving ahead, then the pre-dentate period. Pre-dentate refers to the period from the birth to the eruption of the first deciduous teeth in the oral cavity. ये क्या होता है, जो पहला teeth आपका erupt करने वाला है oral cavity में, ठीक है, that is a period from the birth to the eruption of first deciduous teeth in the oral cavity. पहला oral cavity में दांत है, ठीक है, और बचपन से मतलब जो शुरुआती तौर से, तो उसको बोलते हैं pre-dentate period. At birth, the alveolar arches are called the gum pads. They are firm and pink in color. क्योंकि देखिए जो पिंक पिंक हमारे में gum pad रहता है, I'll show you. So these are your gum pads. Okay, see, these are your gum pads. Clear? At birth, the alveolar arches are called the gum pads. They are firm and pink in color. The picture is not clear, but I have shown you. फीचर्स ऑफ गम पैड, जो लेबियल में होगा वो डिफ्रेंशिएट फर्स्ट करेंगे, लिंगुअल वाला बाद में करेंगे. ट्रांसवर्स ग्रूव्स सेपरेट द गम पैड्स इनटू 10 सेगमेंट्स. इट इज इंपॉर्टेंट. ओके, सो यू हैव टू लर्न इट दैट द ट्रांसवर्स ग्रूव separates the gum pads into 10 segments. The groove between the canine and the first molar is called the lateral sulcus, which helps to judge the inter-arc relationship. Okay, so canine क्या करता है, they help in your inter-arc relationship along with your first molar. ओके, तो ट्रांसवर्स ग्रूव क्या करता है, वो सेपरेट करता है आपको गम पैड्स में 10 सेगमेंट्स में, और जो ग्रूव सेपरेट करता है आपको कैनाइन और फर्स्ट मोलर, दैट इज योर लैटरल sulcus, which helps to judge the inter-arc relationship. Now the upper gum pad is horseshoe shaped and shows gingival groove. Gingival groove किसको सेपरेट करेगा, गम पैड और पैलेट को. Whereas the dental groove that it starts as incisive papilla extends backward to touch the gingival groove at the canine region and then moves laterally to the end in the molar region. Lateral sulcus भी वहीं पे रहता है. So you are getting the relationship. The dental groove that starts as the incisive papilla extends backward to touch the gingival groove. They extend backward to touch the gingival groove at the canine region, and then they moves laterally to end in the molar region. The lower gum pad is U-shaped, upper was horseshoe-shaped and rectangular, characterized by gingival groove. Both will have gingival and dental groove. Your gingival groove is the lingual extension of the gum pad, whereas your dental groove joins gingival groove in the canine region. पहले भी यही हो रहा था, जो dental groove था वो gingival groove को टच करा था canine region में, यहाँ पे भी वही कर रहा है. बस यहाँ पे ये चीज़ है कि lingual extension of the gum pad है, और वहाँ पे वो gum pad को separate कर रहा था palate से. Precociously erupted teeth. Sometimes an infant may be born with a teeth that are precociously erupted, पहले से erupt किया हुआ है. If these teeth emerge before the 3rd month of life, they are classified as premature teeth. Natal teeth, they are present at birth, and neonatal teeth, they erupt during 1 month from birth. बर्थ के 1 महीने के बाद आता है वो दांत को नियोनेटल बोलते हैं। नेटल को बोलते हैं जो पहले पैदाइश के साथ रहता है। ऑल्सो जो 3 महीने से पहले दांत आता है उसको बोलते हैं प्री मैच्योर टीथ। These precociously erupted teeth are mostly primary teeth, of which are 85% mandibular incisors होते हैं and 10% are superficial calcified structures that are called as pre-deciduous teeth. याद कर लो, 85% mandibular incisors होते हैं, 10% superficial calcified structure होते हैं, जिसको हम लोग बोलते हैं pre-deciduous teeth. Etiology of neonatal and natal teeth. They are the superficial position. ये क्यों होता है? Superficial position of the tooth jump उसके वजह से हो सकता है. Increased rate of eruption due to febrile incident, hormonal, heredity. Eruption could be dependent on osteoclastic activity in the area of tooth jump. हम लोग को पता है कि बोन का जो सॉकेट में रहता है, बोनी सॉकेट में टीथ रहता है, तो एक साइड आपका ऑस्टियोक्लास्टिक एक्टिविटी चलता है, एक तरफ ऑस्टियोप्लास्टिक एक्टिविटी चलता है। तो ये इरप्शन कुड बी डिपेंडेंट ऑन ऑस्टियोक्लास्टिक एक्टिविटी विद इन द एरिया ऑफ द टूथ जम्प, यानी बोनी सॉकेट। देखो नियोनेटल टीथ, सॉरी नेटल टीथ, यू आर born with this teeth. Incidence. The incidence of natal and neonatal teeth is mandibular incisor 85, maxillary 11, mandibular cuspids or molars 3%, maxillary cuspids या molar 1%। ऐसे याद रखना है कि जो maxillary है वो 1 के में परसेंटेज में, तो 11 1 1 1 1 ओके। 11 will be standing for maxillary incisors and maxillary molars के लिए 1% है। mandibular incisors 85% तो 853, that would be little easy, मतलब इसका कोई लॉजिक नहीं है, फाइन। Now, deciduous or primary dentition. It starts with the eruption of the first deciduous teeth, usually the deciduous mandibular central incisors, and end with the eruption of the first permanent molar. ठीक है, premolars बच्चों में नहीं होता, तो don't ask such silly questions. It arises from 6 months to the 6 years of post-natal life. 6 से 6 महीना से साल. By 2.5 years, the deciduous dentition is usually complete and in full function. Root completion या formation of all the deciduous teeth is completed by 3 years of age. Features of deciduous dentition period. ये बहुत important है, maybe a 5 mark का question. So both the dental arches are half round in shape or ovoid. Half round in shape or ovoid. You're getting? Half round. Almost no curve of speech is present. Shallow cuspal interdigitation. Slight overjet and overbite. Vertical inclination of the incisors. Little or no crowding. इसमें बहुत सारा वर्ड आपको नहीं समझ में आया होगा. Curve of speech, overjet, overbite. We'll deal with them further. पहले ये पढ़ लो कि होता क्या. Just learn them, mug it up. आगे समझाया जाएगा कि क्या होगा. Both the dental arches are half round in shape or ovoid. Almost no curve of speech is present. Shallow cuspal interdigitation, slight overjet and overbite, vertical inclination of the incisors, little or no crowding. Okay, now there is spacing. So I'll show you. There are 2 types of dentition, that is spaced dentition and non-spaced dentition. Spaced dentition is as good as spaces in between the teeth can be utilized for the adjustment of permanent successors, which are always greater in size compared to the deciduous. See, ये मेरा कुछ मान लो, सॉरी बहुत ज़्यादा वाहियात हो गया। ओके, आई विल शो यू वन मोर थिंग कि समझो ये मेरा सेंट्रल इंसाइजर है, ओके। देन आई हैव लैटरल इंसाइजर्स, दे आर वेरी स्मॉल इन शेप, ओके। कम डेसिडियस है। अब देखो कि इन केस तो देयर इज अ स्पेस, यू कैन सी, so you can see the space in between them. These are your primary dentation or deciduous one. So जो अब बड़ा दांत आएगा मतलब your permanent, तो वो ये स्पेस को ऑक्यूपाई करेगा. So this is your permanent dentition. तो ये क्या बोला कि space dentition is good as spaces in between the teeth can be utilized for the adjustment of permanent successors which are always greater in size compared to the deciduous. समझ में आया, ये जो जगह है उसको permanent dentition यूज़ कर जाएगा. So this is your space dentition. Moving ahead.